Let me do it. Hi, good afternoon everybody. I'm Dr. Premganesh Ganaisan and I'm an orthopedic surgeon from Oriental Straits, Malacca, in Malacca itself. Thank you very much for spending your time and joining us in this live Facebook session. I would like to thank my hospital also for the opportunity for me to share some of the information I would like to give out everybody. So my topic today will be about muscle and joint pains, which you've recently discovered or rediscovered. I've worded it as such because maybe you've had these pains before and they've re-emerged, or maybe something has just occurred over this past short period of time, and you may have doubts or nagging questions which you would like to clear, so it's a sharing session for everyone. I'm primarily going to focus on the upper aspect of the body today, the neck, shoulder, around the elbow, back and buttock, but please feel free to ask me any questions because this is an open and sharing session. So if you realize the most commonest MCO activities during this period of time was ranging from hyperactive to sedentary and extremely sedentary. So you will see a lot of people starting to get into super fitness mode, trying exercises, going around dancing. If you have seen it in the TV, everybody was trying to do a little jig of their own based on our Prime Minister's statements. And then there were others who started doing massive spring cleaning of their house, doing all sorts of household chores, from mopping, cleaning, picking up new activities such as gardening, cooking, and that sort of thing. And then those who also are trying to catch up on Netflix, sitting at home, catching up on all those episodes of Netflix, relaxing, slouching on the sofa TV, and getting back into video games. So if you've realized over this period of time that you've discovered some form of discomfort, aches or pains in this area, or they re-emerge after some time, this is where I'm going to try to clarify it for you. So, the thing about trying to come to a diagnosis for everybody is you need to get a proper history from the patient or whoever you are. It works two ways. We will try to elicit as many questions as possible from you, but it also helps if you can give us as much information as possible. So I've broken it down to these three things. Questions you need to ask. All about the pain. What have you done about it? And now, what do you need to do about it? Because you don't want to be sitting worrying the whole day, whole weeks, whole months thinking, why is this not gone off? Why is this still recurred? My biggest worry is sometimes we tend to wrongly diagnose things. We do self-diagnosis and we start popping pills. Popping pills is not the first remedy to any form of treatment, and you don't know in the long term what sort of effects it's going to give you on the general. So all about the pain means where exactly would you be having the pain. To help me during my presentation today, I actually have two assistants, one gentleman over there and one gentleman behind here. You realize there's social distancing between me and him, and this guy being too close to me, I put him on a mask, but he doesn't say much. Alright, so anyhow, all about the pain means where exactly is the pain. It could be somewhere between the neck and shoulder. It could be isolated just to one place here. It could be moving all the way down and all the way to your buttock. Yes, you can actually have a buttock pain and not know exactly why. And then when did it start? Has it been there for a long time? Has it just reoccurred? And what I mean by the term what is, was there an activity which you did which triggered the pain? Or is there an activity which you do which aggravates the pain? Is there something which you do which relieves the pain, which the pain settles down? Alright? What have you done about it? Have you left it because we think it's probably something small, it's trivial, it will go off? Have you tried home therapies like take all those gels, applied something, got in a personal massage therapist, paid your wife, your children to massage you, or you've tried taking all sorts of medications? But what next when these pains and all these things don't go off? When should you start worrying? When and whom do you need to consult? Okay? So we'll start with neck and shoulder pains. If you look at the image, there's a bald gentleman there, ringing in pain from his neck all the way down to his shoulder. So my aim when you're trying to settle neck and shoulder pains is primarily for you to see whether it's more of a muscle problem originating from the neck to the shoulder, or something within the shoulder joint itself called the rotator cuff and its associated ligaments, or more worryingly, nerves. I hope you can see my slides and my models clearly. So, this is an image of all the muscles around the neck, the shoulder, and if you look at this area, is the ligaments involved in the shoulder joint. And this side here is the neck with all the nerves coming up. So what does this tell you? There are multi-layers of muscles, multi-layers of ligaments, and multiple nerves coming up, which with all this medical jargon that is trying to say any one of these things can cause problems. So it's just not a matter of self-diagnosis. Okay, so all about the pain. Where do you think the pain originated from? Was it from the neck? Is it at the shoulder? Is it a combined area? Normally neck pains tend to start along here and they go all the way to your middle of your back at a particular movement. When do you think this pain started? Were you active in sports previously that you injured your shoulder or neck? Could it have recurred after you started doing some household cleaning? For example, for those who don't know what this is a mop. If you've picked it up for the first time during MCO and you attempted to clean a floor, you've done the entire mopping. You have one spot on the floor where you think there's one dirty stain that I got to get, and you start taking the mop and scrubbing, and suddenly you feel that, ow, a sharp pain in the back here. That's not usual, which means there's some kind of activity which has triggered the pain in your shoulder. Alright? I'll put the mop away. So, that's what I mean by what triggered the pain. If you look at my scenario there, a lot of us have gone into really fit, trying to get into fitness. We started doing push-ups for the first time, aiming to hit that 100, because majority of people have Instagram accounts. If you're on Instagram, you're probably going to log into some fitness guy who's going to tell you hit 100 push-ups. And then right after the 100 push-ups, you're going to say, why can't I even lift and brush my teeth? So you've got to decide why those pains occurred. Okay, so if it's generally muscle pain, it's going to be superficial. You're going to have one point which is going to be painful. Like I said, after 100 push-ups, you've done this, and you've been pushing and pushing and pushing, and you have pain in the front here, and then you prod, there's pain, then you know it's probably a muscle pain. Stretching it to the back probably relieve some amount of pain. Stretching your neck forward relieve some amount of pain. And everybody knows yoko. When you start bathing yourself in yoko and you find the pain is gradually reducing over a short period of time, muscle pains, depending on how badly it's injured, can heal anywhere between 2 to 3 days to 1 to 2 weeks. Because of course, logically speaking, if you injured a very large muscle, it'll take a longer time to heal. But usually muscle pains tend to heal slowly. Gradually but slowly. But what about if it is involving the shoulder joint? Like I said, this is the shoulder joint. A very mobile joint means it gives you all sorts of functions like this. You can reach forward, you can reach to the side, you're reaching upward, you're going back to comb your hair. Like majority of us have not got a haircut for 2 months plus. When you're trying to comb your hair at the back and suddenly you're reaching, you suddenly feel a sharp pain. Those are all things which could be affected from your shoulder joint. If you remember this slide I showed you earlier, you have muscles on the top, you have ligaments on the top, and then you have this area within here which is another set of ligaments called the rotator cuff, and you have overlying muscles. So it's like a complex sandwich of muscles, ligaments, muscle, ligaments. So the thing about rotator cuff and ligaments injury, you can have an intense pain. Remember that mopping action I told you about? You mop and suddenly you have a jerking movement. There's severe pain there. Then gradually it dulls out. But then the pain is always there, a nagging pain when you lean onto your shoulder, when you're sleeping and you're hugging your loved one, and suddenly you feel a sharp pain on the inside and you know it's not your loved one, it's your shoulder, then it's probably something involving deeper inside your shoulder joint. Alright? And then there's a specific movement which causes pain. Movement to the side, movement to the front, movement to the back. These are all kind of indicative for rotator cuff injuries. Then we move on to it involves a nerve. Because like I showed you in my sample just now, and you also can see in my system, inside this circular object is your brain. Then you have your spinal cord running all the way down, and all these yellow fibers coming out like octopus tentacles are your nerves. Your nerves primarily have functions to give you sensation, that means touch, temperature, warmth, this sort of thing. It gives you a function to move your muscle and your joint, and also like those reflex actions. I'm sure everybody's had the little hammer hit on your knee and suddenly there's a knee jerk reflex. So if you have a nerve pain, and if you can appreciate my slide, you'll see that the pain can be radiating. It can be a sharp pain along the neck, and it can go along the back of your shoulder. It can go all the way down to your hand. So you will have this pain and discomfort. There'll be a tingling pinprick sensation, a sharp pain, and something which radiates down all the way, and sometimes can be associated with numbness and weakness. Okay, so we move on to question 2. What have you done for it? Think about it. Check your posture. Check your mattress. When is the last time you've changed your mattress? Because mattresses have a lifespan, believe it or not. Because if you look at our mattress, our backbone, you will see there's a curvature. It's a natural curvature of your spine. So after a while, your mattress is supposed to support you in this way. But if you have not changed your mattress for a long time, the support is lost, and you end up curving in an unnatural position, because we don't know what activities are happening on a mattress. People have jumped, people have rolled. I usually suggest to flip a mattress over or rotate it 180 degrees every 6 months or so. Check your posture. If you look at the image on the screen, you'll see that somebody is relaxed, watching TV or fallen on a book. And if you wake up in the morning with pain around the neck or the shoulder, it's probably a posture problem. Because you've been lying down in that position between 6 to 8 hours or 2 to 3 hours in an unnatural position. You probably can attempt to massage it out. You can put all sorts of gels and rubs, and it should settle if it's a pain, if it is a muscular problem. But when do you need to seek further treatment? When the pain is persistent, the pain is from inside the joint, which you feel is nagging, is getting worse. What do I mean by worsening pain is, just say for week 1 of May, you've taken 1 painkiller for this week to take away the pain. But next week, you're having to take 2 painkillers. And then the week after, you're taking 2 painkillers a day. That shows progression of your symptoms, suggesting the pain is getting worse. Your function, your activities are all becoming limited. You can't move that much. And you have something suggesting that your nerves could be involved. So that's when you need a consult. Okay? As we move on to elbow and places above, it's very similar to your shoulder joint. The elbow involved, you could be having pain within the joint, around the joint, along the forearm, and any particular movement of the joint. If you realize from my images, the basic idea is muscles from one side cross the joint to the other side, innervated by nerves which help you in function. So that's the natural problem. So you will have, sometimes you may be wondering why your wrist movement may be causing elbow pains, your shoulder movements may be causing forearm or bicep, your bicep area pain. Okay? And very similar, there are so many muscles crossing the area, so many nerves crossing the area. So it can be a vast area, a vast number of problems. So let's see, question 1 again, all about the pain. When did this pain occur? After you attempted all those push-ups, you feel a sharp pain around the elbow, whether you've done some tricep extension, or maybe you started carrying something up this way, twisting over, you know. Or like in my images there, you see you're trying to open a doorknob, there's a sharp pain around the elbow. Wringing clothes when you've taken it out of the laundry, there's pain along your elbow and the wrist. Or You know the time when you are very late at night when you're sneaking down to the fridge, trying to quietly open those jars of peanut butter and cookies, and you have a severe pain somewhere, and it runs all the way along your elbow. These are unnatural pains that you should be worrying about, because you may not have recalled when exactly you had all these problems. So, if you have the pain along the outer aspect of your elbow, inner aspect of your elbow, and the back of your elbow, it's probably an issue with your triceps or your forearm muscles. Your triceps, your arm is divided primarily to two bulk of muscles, the biceps, and 2/3 of it is your triceps. The larger the muscle, the faster it heals. You would have realized if you got into some sort of fitness or whatever, you started doing bicep curls or lifting something heavy, you may have had pain along this area. If you had a bicep muscle problem, it will be primarily focused in your biceps. But a triceps is slightly different because it's a larger muscle and it tapers down to a very thin area of triceps here. So you may have sharp pain along this area. And something called a tennis elbow, because it's named after tennis players which twist the elbow. So they are asking about pain around this side. Golfer's elbow will be pain along this side. But the thing is, it can be a combination of things, because you don't know exactly what activity which has triggered these symptoms. So think about it. Was it a sports activity? Was it a household activity? Try to recall and see what was the symptoms triggered this pain. Alright? So when we move on to question 2 and 3, which I said which is very important. What have you done for it and can you do for it? And when do you consult? Of course, you can stop the activity which is triggering the pain to allow yourself to heal, logically speaking. That means take a break from the triceps, push-ups, those tricep extensions. But things such as household, you can always take a warm compress. Why I tell a lot of my patients when I suspect there's some muscle injury of sorts is, when you take a shower, take a nice hot shower, direct your shower to an area, because anything warm and hot increases the blood flow to a damaged area. When more blood flows to that area, the body's natural healing factors are pushed to the area. And then after that, and do some stretching exercises to help open up the joint or the muscle. And then apply a gel. We will buy we have so many gels which they have in online, in the pharmacy, and that sort of thing. But you got to. My advice is don't simply unnecessarily buy it. When you're going to purchase it, speak to a pharmacist or get a consult. And it's safer because you don't know whether you could be, one, you could be allergic to certain chemicals within the gel. 2, you may not be requiring the gel in the first place because it could be an issue somewhere else. But if you think it's a muscle problem, my advice is, because like I said, if you remember it, muscles are large. They encompass a large area. So, if you're going to just say, for example, you've hurt your neck muscle or shoulder muscle, apply the gel equally, equal distribution over a larger area. Massage it in slowly. Don't be too aggressive, because rubbing these muscles is not going to aid anything. It's going to cause it to be more sore. Rub it inside slowly, gently, do some stretching. Of course, you can try all these splints like you see in my mannequin here. But the thing is, if we tend to self-diagnose and we invest in putting money in these splints, and it is wrong, and it is not an indication. 1, you're treating a wrong problem. 2, you're wasting your money. And believe me or not, last time when I was giving a presentation about neck pain, somebody posed the question, can I buy this neck traction thing from an online website? It primarily locks into the door and it's supposed to hang you this way. Think about it, you're actually hanging yourself. So that's why I get very apprehensive about buying splints by ourselves without a consult of a proper medical practitioner or a doctor. Okay? So when do you consult? Like I said, logically speaking, when the pain is worse, it's limiting your activity, and it's just been there too long. 5 years, 4 years, 3-4 months, if you cannot get back to your activity and it's just annoying, that's when you need to seek a consult. Alright? I hope I've been clear so far. So thus far we will be moving down to issues about the hand. There's a gentleman who said, Mr. Urogynecology from Penang said, good presentation, thank you very much. I hope it's benefiting to whomever is listening in. And another gentleman asked about selling ointments on gel and paste. I kind of mentioned it earlier. Everything has a different component within its different ingredient. You can buy it on Facebook, you can buy it without seeking a consult, but because it's a medical based treatment, if you're going to purchase it, I would suggest at least going to the pharmacist, because they are equally as knowledgeable as us in a pharmacology aspect. They will tell you what's better. They will even advise you how to apply it. And always, if you're making any purchase, read the instructions. Those instructions are there for a purpose, and I still do the same thing. I think all of us should do it as well. Okay? So as we move along more downwards to hand problems, all about the pain. If you look at our hand, very commonly people have come up and told me, doctor, I have tingling and numbness sensation on my hand, but upon further questioning, you will see it's these outer 3 digits. It may start in the wrist and be focused around this area. It will be coming along your forearm sometimes. And then the other thing is, you'll tell me, doctor, I also have pain along my wrist at certain particular movements. So then we ask them, and then you should ask yourself, when and what aggravates this pain? If you can appreciate these images, you can see 3 different images doing common issues, common things with our hands which can trigger this pain. Those on top of the computer bending the wrist, or those on playing video games moving the joysticks, or those who suddenly have discovered the inner chef in themselves, where they are holding the saucepan, holding the pots, flexing your wrist as such. And we all remember the monkey who carried up the baby lion, right? Yeah, sorry, it's called a Lion King. Yeah. Where the Simba was lifted up by the monkey for a reason. I'm sure if you ask the monkey after that, the monkey probably had wrist pain as well, because he lifted that baby cub over and over again. So it primarily involves bending and flexing the wrist in an unnatural position or over a prolonged time. You'll be surprised, I'm wearing this watch also, because sometimes even if you wear this watch too long, too tight, can trigger these kind of symptoms. Commonly, it is these two. I'm not saying that, I'm sure there are many other problems which can be triggered, but very commonly, patients which I see in the clinic and who come up to me are about carpal tunnel syndrome and decurvane tenosynovitis. These are just medical jargons which is named after the problem or the person who's found it or what it is trying to say. So let's begin with carpal tunnel syndrome. Carpal tunnel is named after an area in the wrist. If you look at this model, I've highlighted this area called in blue, which is called the median nerve. Like I said, our nerves come all the way down from the neck, they branch out like octopus tentacles, and they go into the wrist. So, if I bring up my model again, this nerve runs in the center here. If you look at your hand, if you make a clenched fist and you bend it forward a little bit, you'll see 2 straw-like structures. These are tendons. In between those tendons is where your nerve runs. So carpal tunnel syndrome is anything where that central nerve is being compressed. If you were to bend your wrist and you press in that area just at where your wrist is flexed for about 20 seconds, you'll feel these numb symptoms, or anything which is injured from the inside, which is compressing that median nerve. So like I said, you will have all the symptoms of numbness, tingling sensations and pinprick sensations on the outer 3 digits of your hand. You will have sleep pains. I'm sure many of us, like me, love to hug bolsters or what if somebody else is with you. If you're sitting and hugging for a long period of time like this, you keep your wrist flexed, you'll get up at night suddenly sometimes thinking, why do I have this sort of sensation? So we tend to shake it off and it goes off, because when you release your hands from this position, the pressure is taken off the nerve and it tends to go off. But it will recur and resolve because there's something which is compressing your wrist from the outside. Decurving stenosynovitis on the other hand is very commonly seen in the side of your wrist. If you open up your fingers and you will see another straw-like structure running here. This is another tendon. It is actually these 2 tendons rubbing against this part of the bone. If you feel your wrist, you'll feel a sharp prominent area here. This is part of your wrist bone. So you have these tendons, these 2 tendons constantly rubbing against it. So logically speaking, if you look at these 2 hand conditions, it is something which is compressed on the outside or something we are doing. So if I have my wrist flexed perpetually for long periods of time, like how on a computer playing video games, you will compress your median nerve. If I'm carrying up the baby lion like this over and over again, or I'm trying to cook, bending my wrist over and over again, in this way, you're going to trigger the symptoms. But how do we differentiate it? Okay? Carpal tunnel syndrome, like I said, is a nerve problem. Because it's a nerve problem, it's going to involve numbness, pain and pain sensations. And it's primarily because, oops, my sister got a bit too hyperactive. It primarily involves getting flexion of bending of your wrist. Decurving stenosynovitis, steno meaning tendon, itis meaning inflammation, is primarily an issue of your tendons, and a pain at the side of the wrist, and a downward twist. So question 2 and 3, what have you done for it and how do we manage it? First, identify which syndrome it is, because we cannot treat it if we don't know what it is. We try to identify what is the cause, what is the action we did, what did we do to cause this pain. And if you see, I put it in big blue bold words, something called ergonomics. And right next to it is how you should be sitting. Because instead of us flexing over and having these unnatural positions, we should maintain a proper posture, a relaxed position of the wrist, a relaxed position of the elbow. So in this natural position, you are taking off the unnecessary stresses on these nerves and the muscles. What can we do for it? Obviously, you can avoid the activity. So if you are going to be bending your wrist over and over again, try to stop. If you don't want to be in a computer, try to stop. But logically, how often can we stop doing that? If you're already addicted to playing video games, you're going to carry on. If you need to twist and dry your clothes, you're going to carry on. We can attempt these splints and braces and that sort of thing. But like I said, you need to identify whether they really work, whether it's a correct pathology, correct problem. So identification is important. Okay? So I have a question. A gentleman, Mr. Nuramin, asked me, if I have an injured muscle, is it true that it's very good to bathe in ice and cold water? So look at it. This is what I believe, and this is what I usually tell my patients. When you have an injury at that time, because everything is swollen, you want something to reduce the swelling. It's good if you take a cold compress. Take a bag of ice, compress it over it, because you want the swelling to reduce immediately. But when the swelling reduces over that 1 day or so, After that, it's not going to suddenly swell up again, but you've probably injured the muscle at that time. So immediately when you have an injury, just say you play soccer or you carried a dumbbell or you have severe pain, you can apply those gels and you can put an ice pack to reduce the swelling at that time. But the muscle injury underneath per se, depending on how badly it's injured, you can always put a warm compress to increase the blood flow, do some stretching, and then the swelling and the pain will be reduced. It's a mix of both. One is done acutely at that time of injury, and after the other one is for control of pain and swelling over a period of time. Thank you, Mr. Chui, for your comment. I appreciate it. Okay, lastly, I hope this far I've been helpful, and if you have any questions, please feel free, even if it's not regarding the topics which I'm speaking about. Lastly, back pain. Everybody's had it, everybody will experience it. A lot of people are suffering from it. It's a very, very extensive issue because, like I'll show you in my model and even in an example, you see the muscle from the back starts at the neck, goes all the way to your bottom, and literally, pun not intended, actually goes all the way to your bottom. So you will actually can feel back pain and buttock pain at the same time. So if you sometimes after your heavy squats in the gym, when everybody's trying to get those glutes which we always dreamed of, you can actually have buttock pain. It's because the back muscles and buttock muscles are all interlinked. Underneath all those buttock muscles and back muscles are nerves coming out all the way down here. So sometimes when you're sitting on a chair, you're literally also sitting on a big large nerve right at the back. Of course, if you prod your buttock at the moment, you're not going to feel anything. But you sit for long hours, sometimes you can compress that nerve. Okay? And then after those nerve issues are settled, you have all these complex nerves and all these bones at the back there. So looking in this image, very common causes of back pain would be muscle problems or sprains. Spondylosis is a medical term for wear and tear. Let's face it, ladies and gentlemen, we're all growing older. We haven't found anything yet to keep us younger, so wear and tear of every joint, every muscle will happen. These in blue are medical terminologies for things which can go wrong along the spine and the spinal area, which I'll explain a little bit later on, excuse me. And of course you could have fractures. Other issues about back pain is the site, which I won't get into, but it also can be an area from the surrounding. So why is it tricky? Like I said, you've got multiple layers of muscles, multiple areas of nerves where you can be compressed, and multiple areas in the bone and spinal cord which can be triggered. So go back to our question all about the pain. What, when, and where? What triggered the pain? Was it a sporting activity? Did you take the mop again, try to clean something really high and reach, and suddenly you have a sharp pain? Or you're trying to pick something up and bend at this area. Was there a sharp pain at that area? Because you see, majority of our movements occur at the lower back, and this back of our lower back, just above our buttock. Most of the movements go here. So if you think that, you know, the day when you suddenly got excited about Zumba and you started dancing and did a twist and suddenly there's a sharp pain from your back to your buttock, those are the things which has probably triggered your pain. And then maybe some spasm from an unnatural position. I'll show you what I mean later. And like I said, age is a degenerative process. But the thing about it is, because I try and make an effort, just like how I would ask you the same questions. It can be localized to one area, it could be moving along your buttock, and it could be one area of your leg, like you see in the images. Just along your back, it could be from your buttock going all the way down to your leg, or maybe to your calf, maybe just stopping at your buttock, or just sometimes just one particular area of your calf. you've got to decide and try to recall whether those are the symptoms of what you're complaining of or feeling. And this is what we will be asking you as well. What I meant by spasm in an unnatural position is bad sleeping positions. Check those pillows, check those mattresses. Bad sitting positions, like I said, stress important about your posture, check and see. Because these things primarily are causes of what causes muscle and back spasms. But if it's a nerve problem, you see, like I said, disc prolapse, the slip disc. A disc prolapse is the medical term for slip disc. Stenosis, if those who are unfamiliar with this, anything which is causing a constriction. So if you look at our spine from when it's been cut in this way, this yellow area is your spinal cord with the nerves coming out at different levels. So anything which is going to be compressing the nerve, like a slip disc, that means it slipped out of its place and compressing the disc, or anything in the bone which is compressing the disc and making the area smaller will cause nerve irritation. Okay, spondylolisthesis is basically your nerve, the spine running out of place. But like I said, a spine issue is very complex. You need a thorough history. It can be progressive, so you need to get a consult if you want to get further information. It's not something which you can jam pack in the short session. So, the differences between a muscle problem and a nerve problem. A muscle pain would be something which is during movement side of the spine, usually because, like if you recall, I said the muscles start at the back and they go all the way to your buttock. So it will not be exactly in the center, it will be more at the sides. When you're bending down, you will feel pain along the side of your back, going to your buttock. Pain when you're resting, twisting movements will aggravate the pain. It depending on how badly you're injured and how much of yoko you have put, or how much of stretching like yoga. I can't do this yoga movement, but those who are attempting to stretch it out, you will feel the relief of pain. Those are muscle pains. But if it's a nerve problem, because like I said, majority of our movement occurs along the lower back, where as we grow older, the amount of activities we do, you can trigger these nerve issues. It will be initially starting at the back, most central, but gradually it will start spreading. It can go up to the buttock, it can go down to the center of your buttock and go up to your leg. It can be specifically just one area here. It can be along the back of your leg. You can actually feel, like I said, numbness, tingling sensations, pricking sensations. Those all indicate there could be a nerve element. Alright? The leg pain can be it can also involve both sides. So in general, what I'm trying to say is, when do you need to worry? When do you need to see get a medical consult? When do you need to see an orthopedic surgeon? When you should not do anything is when you have worsening pain and you're taking more painkillers. Like I said much earlier, if you have pain in your back, shoulder, neck, the first week of May, for example, you took one painkiller, Monday, Tuesday, then you stopped. And the next week you took it for 3 days. The following week you're taking it for 4 days. It means there's progression. Something is not right somewhere, because you're having to rely on medications to get a better quality of life. When your function is becoming more and more limited, when it's a nerve issue, you're having numbness along your neck and your hands, along your leg, you can't function, your quality of life is reducing. That's when you should stop. I would say, start worrying, get a consult and do something about it. Because my advice, don't pop painkillers. They're not going to give you any benefit. They could be for the wrong condition completely. They could be causing general deterioration of the other systems. We all know, everybody knows, because we all Google things, and which is good, because Google gives you answers. But don't research Google, because it doesn't give you exactly the right answers. Don't pop pills, because you know it can cause systemic problems. Don't leave it alone. Don't self-diagnose, because when your symptoms are getting worse, your quality of life is deteriorating, something has to be done about it. Okay, There are a few questions which I can just answer. Somebody asked me what supplements can I take other than calcium for bone health or relief of joint pain. Well, the thing about bone health is before you take calcium, because calcium, although it is good, it should be indicated. I always believe when I'm going to make a diagnosis or treat a patient, I should be evidence-based. Of course, experience counts, histories on the patient counts, my examination counts, but everything has to be evidence-based. If you really do need to take calcium, I always tell my patients first do a DEXA scan, or otherwise known to the general public as a PMD scan, to see whether you really do need calcium. Because calcium tells you your level of osteoporosis. If you are not osteoporotic and you are popping calcium unnecessarily, you have side effects of constipation, kidney stones. Because it's not again, your body can only absorb as much as it can. So you only take calcium if it's needed. But joint supplements, depending on how bad your joint pain is. You see, because joint pain, as we grow older, there's something called osteoarthritis. Osteoarthritis is wear and tear of the joint, very commonly seen in weight-bearing joints. Your knee, followed by your ankle, by your hip, and any other joint which has had injury before. So it's wear and tear of the cartilage, and it will cause pain, it will cause swelling, can cause limitation of movement. There are about 4 classifications of osteoporosis based on the x-rays. But sometimes, just because your x-ray says it's bad, it doesn't mean you need joint supplementation. If you're walking in completely straight, like this, you're able to do squats, 100 kilos, you're super strong, but your x-ray suggests that your osteoarthritis is progressive. It doesn't mean you need to pop supplements. It means you're doing something right, taking care of your joints. It's only if you have pain, there's limitation of movement, and you're having difficulty in your activity, that's when you should take supplements. Usually, it's a step-up issue, step-up medication and treatment for osteoarthritis or joint care. But, like I said, it is not all about medication. You see, I told you earlier, the muscles cross from one joint to the other, one joint to the other. If you're going to take any joint supplementation, but your muscles are not strong, it's not going to aid you at all. If this is your bone, and this is your muscle are holding your bone in place. If your muscles are holding your bone in place and stabilizing your joint, there's going to be hardly any movement of the joint, except what is allowed by your body, like this. But if your muscles are flaccid and soft, it's not being exercised, this is going to be happening. It's going to be moving you will not feel those motion. It's all micro motion within your body. But this is what is going to happen. The more friction there is, the more wear and tear of the joints. So treatment for joint care involves exercises which strengthen the muscle around the joints, stretching exercises, strengthening exercises, of course activities which reduce the stress. For example, if you have a chair and you're sitting down on it, like this, when you're going to get up, or even if you're in a commode, the toilet, you're going to be getting up from the toilet or the chair, we naturally tend to do this. We push with our knees and get up. But you already have the early joint pain, maybe from excessive sports or injuries. You can always offset that by using your hands. So use your hands, push it up. So you offset the stress. And then you can also add in supplements. The things which people normally, we all know about is chondroitin, glucosamine. But even then, everything is research based. Because you can take all the supplements lifelong, but if you don't take care of your joint, you don't offset your lifestyle, and it's not going to aid much. And you can be taking these supplements, it's not going to be aiding, it could be having long-term effects, rarely does, but it can have long-term effects, and you just be spending your hard-earned money on things which is not going to help. Okay, Mr. Mitra, thank you very much for your comment. Mr. Chi asked me, how about Guyon Canal syndrome? I suspect this person is either a medical practitioner or a doctor, or somebody I know. He said, is it wrist pain too, but not the veins? Yeah, the Guyon Canal syndrome is a compression of another nerve in the wrist. not as commonly seen as carpal tunnel, but yes, it is also a compression of the nerve in the wrist area, presenting with similar nerve compression symptoms, but in these two fingers. Carpal tunnel is the outer three, Guyon canal is the inner two. Also some sort of separation. Mr. Isaac, I will answer your question shortly as I'm just finishing my presentation. So, as I'm finishing, diagnosis of any problem requires a proper history from you, so that you have an understanding of what's going on. You will at least know when it happened, how it happened, where exactly it is. Relevant questions from us. A detailed examination. It is not just you come and tell me what's the pain and I give you a painkiller. That's not the way it works. A detailed examination and medical aids, because it is helpful. X-rays, CT scans, like I said, a BMD to know your osteoporotic status. All those is helpful. So it is always better to seek a consult, because you will get correct diagnosis, safer management of your symptoms. You will gain the right knowledge, like what I'm trying to impart now. So because then you will know what to do, what not to do. It's just not about treatment, but because you don't want to treat the symptom or the pain at that time. You want the prevention of this thing to happen. Because I don't know, because when I was studying for the first time, I also never thought about the mattress thing. Because I myself never changed my mattress after many years. Then I realized, yeah, it makes sense. So maybe whatever I told you all now, you can go back and think about it. And hopefully with all the right diagnosis, the right management, alteration, a change of lifestyle, and any questions which you all have which I can answer, there will be better outcomes. I hope I've been helpful, and thank you very much. Please stay safe. To answer Mr. Isaac's question, he asked me, I specialize in Ilizarov surgery. Ilizarov's, I completed my medical degree as and then I did my orthopedic surgery, and I subsequently went and did my postgraduate, my subspecialty, and my focus is an extra 3 years of specialized studying, and my focus is on complex fractures, all those shattered bones around the joints, something called Pelvis-Acetabulum surgery, and musculoskeletal infections. Ilizarov surgery is another subspecialty which I learned from great teachers in Malaysia as well as Italy and Bangladesh, which is named after a Russian surgeon called Mr. Gabriel Ilizarov. If you type it out, you will see it is actually rings, large circular rings around the bone to address infections, shattered fractures, bone loss. Because sometimes you have these horrible road traffic accidents where people shatter their limbs and they've lost bone, and it's a gap, it's a hole in the center. But with Ilizarov surgery, you can address the damaged tissue, not have to put a piece of metal inside risking infection, and you can regenerate bone to a certain limit. You can also correct deformity. That means if you had fracture, when I was in Bangladesh, and even when I was in training in Serdang and Seremban and Klang, sometimes you have fractures which people don't want to treat. They go to bone setters, BOMOs, with good intentions because they may be apprehensive about surgery, but they come back with bent bones. When you bend the bone in an awkward position, you have to realize you lose function, you lose nerves, function, that sort of thing. So you want to straighten the surgery. So Ilizarov surgery, where you apply these rings, you can actually correct angulation, you can correct deformity. It also is a surgery where, in case you've had some kind of implant, some kind of metal device in your body for your fixation somewhere, or you've had a very bad infection of your skin, and you need to treat it, but you cannot put hardware inside, or you need to put some kind of soft tissue skin on the outside, but you need the patient to walk. So Ilizarov surgery can address that. You can put these rings, correct these bones, stabilize these bones, and you can help with the infection. The idea of Ilizarov surgery is you put these rings, you address the problem, and the patient can walk. where if you Google pictures, Ilizarov, you'll see people swim with it, people run with it, people walk with it. I've had patients in GH, and since my practice here in Oriental, over a year, I've had patients shattered bones, broken in 5-6 places, put these rings, and I tell them to walk immediately. That's the idea, because it's a 3-dimensional, super stable construct. I hope I've answered your question. Mr. Frick asked me regarding pain around the neck and shoulder and numbness in hands that occur in a long term, like 3 years to 4 years. He consulted a neurosurgeon and given a painkiller. Mr. Frick, I'm sorry that you had to have these symptoms for so many years. What should I do? You see, because the thing about pain, you see, your symptom is classic of something which can be confusing. You've had pain, neck, shoulder, numbness in the hands, and I'm sure your neurosurgeon has done his best. They probably have ordered an MRI, and they've probably given some sort of medication. The MRI, I'm sure your neurosurgeon has done a complete examination, and they made a conscious attempt to explain what nerve is irritated, whether it is actually coming from the neck base itself, from the brain, is there a particular branch of the nerve which is irritated, and they probably examined you thoroughly to see which function you have lost or it is affecting you. Movement of the elbow, movement of the wrist, and that sort of thing. And I'm sure the neurosurgeon has also done an MRI. So, based on what you've explained, if I've had a patient like this coming to me for the first time, I will still follow my standard protocol. A proper history, proper examination, see specifically where I need, what sort of images or scans I need to do. For a problem which I suspect is a nerve problem originating from the neck or the shoulder, I will get an MRI of the neck and the shoulder. But you see, if I think it's primarily a shoulder problem, I will just do an MRI of the shoulder. If I think there is a nerve problem, based on history, it originates from the neck, affecting my shoulder and my hand function, it's going all the way down to my fingertips. Maybe during my first consult, I'll do an X-ray to see the quality of the bone. But to determine whether the nerve has an issue, it is coming from the disc, the ligaments, or the nerve, I would get an MRI done. But I'm sure your neurosurgeon did that. But the thing is, sometimes, like I said, these issues are degenerative, they're progressive. As we grow older, there's more activities we do in ourselves, change our lifestyle, change our sports, change of, as we're growing older, so it's degenerative. So an MRI from 3-4 years ago may actually show a difference now. So if your symptoms are still persistent and it's still affecting your day-to-day activity, maybe you should see a surgeon or a spine surgeon or an orthopedic surgeon, relate your symptoms, and when you're going to see a medical practitioner, if you're able to, please bring the MRI if you have done one from many years ago, because there's a probability your current doctor or a future doctor is going to repeat this MRI, and we will need to see a comparison, whether there's a progression. Because even if I was to do an MRI for my back now, I will probably show an element of a slipped disc, but I don't have a symptom. That does not mean you should not be treating a person based on an MRI. It always goes back to what is the patient complaining of? What do you have? If you're walking in straight and I just do an MRI and I see a disc bulging out there, I can't be asking you to do surgery. I would probably tell you what you have, what you should be cautious of, what you may anticipate in the future. But I wouldn't say surgery because you don't have problems, you don't have a symptom. So if you, Mr. Frick, if you are going to seek a medical consult, I would suggest you go see somebody because your symptoms are still persistent. Bring that old MRI, and probably the doctor or the medical practitioner who's going to review you after this is probably going to repeat an MRI, and they can make a comparison, and I hope your issue is solved. Thank you again for the question. Ramelia asked, better to use sitting or squatting toilet? It depends on how bad your constipation is. No, I'm just kidding. Sorry, because I just wanted to lighten up the mood because sometimes when you talk too much of medical things, everybody gets lost. You see, so a sitting and squatting toilet, it depends on, sometimes not all of us have the privilege of a sitting and squatting toilet. But it depends on what symptoms you have, okay? See, in your sitting down, you're sitting in this position. You're straight, you're sitting very comfortably or on a stool, there's no stress anywhere. And then there's no stress on the knee. The only stress is when you're trying to get up from your chair, there will be stress on your knee. But if you have a back problem, a pre-existing back problem, muscle pain along this area, muscle tightness along this area, or you have hip pain, or you already know somebody has told you you have masalah sakit sendi, osteoarthritis, anything which aggravates that position and is going to put more stress on that position is going to be painful. So, Amelia, if you have, I don't know whether it's you or you're asking for a loved one, just say they've already got some tight back muscles, or they've been told that they have got wear and tear in their back, or they've got very bad joints. Squatting down like this is going to put a lot of stress on your back and the knee joint. So it primarily depends on where is the pain and what is the pain you're having. The best is always a sitting toilet, because sitting toilet, less stress, not much on the joint, you're sitting comfortably. When you want to get up, you can use your hands to push. A squatting toilet puts a lot of stress on your joint, your back, and your hip joint. I hope that answered your question. Mr. Tan asked me, frequent neck and shoulder pain during work and upon waking up. Diagnosed as muscle impingement. Given Voltaren gel and pills. Still having some pain, I assume. Okay, so yeah, Mr. Tan, you see, like I said, you know, these neck pains and the shoulder pains tend to recur. Pain during work and pain upon waking up. I get a lot of that. People tell, I ask my patients that, and some of them have told me that. I realize that's a very important question. Pain upon waking up. When you see, when you're sleeping, you're supposed to be in the most rested position. When you're resting, you're supposed to be in the most rested position. Even I have it. Sometimes when I doze off on the sofa, I wake up having neck pain. So if you're pain waking up, what it's trying to tell you is your body or your neck muscle, because see, that I'll use this gentleman as an example, if it doesn't fall apart. So your neck muscles are supporting your head and your back, and if you remember my image, my screen from far earlier, you see your neck muscles start at the base of your skeleton and goes all the way to the center of your back. So if you're sleeping, and in your sleeping, even though you turn left and right, whatever, the neck and the head is being held in this position for 5 to 8 hours, depending on how many hours you slept. So it's being held in that position. So if you're waking up with neck pain along the side, going up to the shoulder, coming to the nape of your neck and in the small of your shoulder blade, this is called the small of your back. If it's coming along here, which means your muscle is being put through unnecessary stress or strain over the sleeping position. You can attempt to change your pillow, change your sleeping technique, or get an assessment and see whether maybe there's something unusual about the posture at night. It's not easy to say. I mean, I've had patients, and it's sad that they say they've tried pillows which they buy online, or pillows which you buy through supermarkets saying you support the neck and this and that. All these sort of things, sometimes you don't know specifically what causes it, but it's a matter of spasm and tightness of your muscle. You know, so when you wake up with pain, it means your muscle is in an unnatural position for a prolonged period of time. And why I say it's neck and shoulder pain, is because the neck muscle starts here, goes here, in a diamond sort of shape. It fans out and comes back in. And then muscles of the small back also get inserted into your neck. Check your sleeping posture. try a different pillow or a mattress. And the other thing I would suggest is maybe doing stretching exercises. I'm not saying naturally you need to go and see a medical practitioner or go and seek an orthopedic surgeon. You can if it's still problematic. But you can always also go and seek advice about therapy, physical therapist. Get some exercises we do on a daily basis, stretching those muscles, just like any other muscle in your body. Neck muscles also need some stretching and strengthening. You can practice, because you said it happens during work. You can maybe during your work time, like I said, take a break every 2 hours or 3 hours if possible, or when you're taking a walk to the bathroom or having a meal. Spend about 15-20 minutes do some stretching exercises, because if you are sitting in front of a computer or bending over something, all these spasms come because you're holding it in an unnatural position for a too long period of time. So you want to give it a break. If you keep your arm out for half an hour, you feel a stress here. Unnatural position in a prolonged period of time. But when you start stretching it out, massaging it over, it goes off. So try that thing, Mr. Tan. Check your sleeping posture, check your work posture, give yourself some breaks, and let your muscle rest. Mr. Han asked me, does prolonged stress cause shoulder pain? Unfortunately, this is going to be my last question. Yes, prolonged stress can give you, I am not a psychologist or a psychiatrist, or do I practice any form of neuromedicine, but yes, it does, because they're all interrelated. The body is the most wondrous machine which we can own. The brain controls everything. So they're all interrelated. When you are stressed, you also feel your body is fatigued, tired, you won't have the urge. They all interrelate. Endorphins, hormones. So sometimes prolonged stress, they all are connected by the same nerves, and they can cause irritation along this area, and they can cause shoulder pain. Yes, it can. And I hope that you can help solve it. So ladies and gentlemen, thank you very much for tuning in. I do hope it was beneficial. Stay safe and take care. Thank you.